Today will be the most controversial podcast I've had to date by far. We're going to talk about cholesterol, that awful substance that our body produces to try to kill us. Well, what if I told you that almost everything you've been told about cholesterol and cholesterol-lowering drugs is a lie? What we're about to discuss today will absolutely challenge and rock your belief systems. So, my challenge to you today is to listen with an open mind, to take the emotions out of it, to listen to what I'm saying about the role of cholesterol in your body, and also to listen carefully to what I'm saying about the data. I'm not here to change your mind. I'm here to hopefully open your mind and to attempt to get you to think for yourself based on the facts and the data instead of a very outdated cholesterol hypothesis. Welcome to the Foundational Health Podcast, where we provide education and inspiration to help guide you on your journey to look better, feel better, and most importantly, heal better. Hello, and welcome to the Foundational Health Podcast. I'm Dr. Kevin Schultz, and today we're going to talk about cholesterol. Well, why is this such an important topic? Cardiovascular disease is and has been for a very long time the number one killer worldwide. And despite tremendous efforts and education on this topic, it continues to get worse year after year after year. So let's start this discussion today with some very important things to really set the stage for all of the things that we're going to discuss later in the podcast. Let's take a bird's eye view of our healthcare system to begin with. So there's 5 categories that healthcare systems are ranked on worldwide. And guess what? The US happens to be ranked number 1, really by a landslide in all 5 of these categories. Nobody argues with the fact that we have the best doctors in the world right here in the United States. We have the best technology in the world right here in the United States. The United States, by far, spends the most money on healthcare annually. We perform the most surgeries every single year, and we prescribe the most drugs and take the most drugs year after year after year. And when we look at the drug topic a little bit closer, the United States makes up 4% approximately of the world's population, and we take 30 to 70% of the world's pharmaceutical drugs. So if all of those things, which make up, again, the healthcare system and healthcare ratings, were actually effective, if those could result in better health, then we should be number 1 in the world, right? When it comes to the measures of health. But when you look at 2 very important categories, when they look now at overall rankings in health, the United States ranks 69th, despite being first in all of those categories. Our overall health is 69th. And we're 48th in longevity rankings. So a little bit scary, and that really sets the stage for a lot of the things that we're going to talk about today. Something else that's also important to understand for this topic is that statin drugs, like Lipitor, by far the most common statin drugs are the most lucrative drug in the history of the world, by far. Lipitor itself is responsible for $130 billion in sales, and then statins as a whole are $1 trillion industry. Not billion, not million, $1 trillion industry. We know that up to 1 billion people worldwide are believed to be on a statin drug. So if you know how many people there are in the world, it is 8 billion. So that means 1 out of every 8 people in the world is on a statin drug. So there's something in the medical world called standard of care. And really a standard of care for anything is how a doctor is expected to treat something. So there are standards of care if you would go in for the flu. There's a standard of care if you would go in for a bladder or a urinary tract infection. Well, the standard of care for cardiovascular disease is based on what I already mentioned, this cholesterol hypothesis. The cholesterol hypothesis, really important to understand. We're going to talk a lot about this today. The cholesterol hypothesis states that the higher levels of cholesterol in your body, particularly LDL, nicknamed bad, higher levels of cholesterol, particularly LDL, are associated with higher rates of heart disease and higher rates of death due to heart disease and cardiovascular death. We also know as part of this standard of care that LDL is the number one factor for heart disease, and the lower the number, the better. Now, I'm not saying that's true. This is the standard of care, states that LDL is the number one factor for heart disease, and the lower you can get that number, the better. And then as a result of all of that, statin drugs are the treatment. So when it comes to standard of care treatment for cardiovascular disease, statin drugs are the number one line of defense. So then the big question from there is, do statin drugs lower LDL levels? And the answer is emphatically yes. So case closed, right? That solves the problem. We know that LDL is the culprit. We know that statins step in and all of a sudden they lower LDLs, so cholesterol levels improve, heart disease improves, death rate improves, right? Well, unfortunately, that's not the case. As we talked about earlier, cardiovascular disease is the number one killer in the world, and it gets worse every single year. So let's go back to the cholesterol hypothesis again. It states that higher levels of cholesterol, particularly LDL, are associated with higher rates of heart disease and death. So where does the hypothesis come from? It started back in the 70s, and they looked at people that had cardiovascular disease, heart attacks, strokes, and they found that these people had clogged arteries. And what was in those clogged arteries? LDL cholesterol. They were lined with LDL cholesterol. That is where the standard of care is based on. That is what the cholesterol hypothesis is based on. So the big question then becomes, if that hypothesis were true, then why, if 1 out of every 8 people in the world are on a statin drug to lower LDLs, why is cardiovascular disease still the number one killer and getting worse annually? So that alone should make you question things, right? You might be thinking, well, it would be probably worse if we didn't have statins, because this is what we're told. Ultra-processed food that we eat, the lack of exercise, the toxins in our food, all the environment, the lifestyle factors, those are all there, and the statins are at least slowing down that death rate of cardiovascular disease. And there's no question, clearly all of those things play a role, but if it were the answer, then we should have some data to back that up, right? So it's the cholesterol hypothesis. It's been around for 50 years. So let's take a look at the data from the medical literature and what it says. So according to the medical literature that comes from the best journals in the world, like the British Medical Journal, the American Medical Journal, and many others, here's what we know. We know that for people that have had a heart attack and been put on a statin, they have an increase in life expectancy of 4.2 days. You heard that right. So if you've had a heart attack, you get put on a statin, the best research in the world shows that that statin drug will increase your life expectancy on average 4.2 days. But that does not make up the majority of the people that are on a statin drug. The large majority of the people that are on statins simply have elevated levels of LDL, the bad guy. So that's why they prescribe the statin. They haven't had any signs of heart disease yet. They don't have a heart attack, or they haven't had a heart attack rather. They don't have any severe blockage. They don't have the definition of cardiovascular disease. They simply have high levels of LDL, so therefore they are prescribed a statin. So if you fall into that group, what do the numbers show? What does that look like? Well, the numbers show that there is no increase in life expectancy, not even one single day. And this doesn't matter how many studies they've done to look at this. No study has ever shown an increase in life expectancy, not one single day, for people that are prescribed a statin without a diagnosis of heart disease. So again, we're going to go back to that cholesterol hypothesis one more time. The cholesterol hypothesis states that the higher levels of cholesterol, particularly LDL, are associated with higher rates of heart disease and higher rates of cardiovascular death. The hypothesis, as we talked about, is based on the fact that when they look at people with clogged arteries, they have LDL in the arteries. So it makes sense, right? If LDL is there, then it's got to be a factor, and it's what's causing heart disease. And again, this is what the cholesterol hypothesis is based on. let's take a look now at some other studies that have led to not just a few, but many doctors, many health organizations worldwide that are now questioning this cholesterol hypothesis. The largest study ever done was a study of 12.8 million adults. This study showed that the lowest risk of heart disease for these 12.8 million adults and the highest potential of survival, so lowest risk of disease, highest potential of survival, were people that had total cholesterol levels in the 200 to 240 range. Now, in the medical world, if you're not familiar, that range, we're told that we want to be under 200 for total cholesterol. The lower the better. And LDL should be under 100, but the lower the better. If you've been diagnosed, in fact, with heart disease, if you've had a heart attack, you've had blockage somewhere, you've had a stroke, then we're told you want to keep those LDL levels under 70 and you want to get the total cholesterol even lower than that 200 to fall into that good range. Well, here's the problem with that. When you look at this study and you look at other studies that are similar, when total cholesterol is less than 200, which is what they want, and LDL is less than 100, all-cause mortality keeps going up. So all-cause mortality, what does that mean? It means death rate from all causes. We know that death rate from all causes keeps going up when our levels are where they want them to be according to the cholesterol hypothesis and the standard of care, which hopefully doesn't make a lot of sense. So here's the deal. The hypothesis is just that. It's a hypothesis. It's not science. And just because LDL is found at the scene of the crime does not mean that it's the criminal. Saying LDL is the cause of cardiovascular disease is literally equivalent to saying that firemen cause house fires. Because, of course, what do you find at a house fire? You find firemen. So therefore, they must be causing the fires. Well, what do we actually know? Why are firemen found at every single house fire? To put out the fire, right? They're the good guys. Well, this is exactly why LDL is found at the scene of the crime. The actual science, not an outdated hypothesis, shows that in times of need, this is how the body works, in times of need, the liver produces more LDL, and that LDL will travel to an area of need to help heal and protect it. Specifically with arteries, we know that the more inflammation, for instance, that there is in an artery, the more scarring there's going to be in that artery. And then as a result, LDL will travel there to protect it. So LDL is the fireman. It is not the arson that we are led to believe it is. And once you understand that concept, it makes sense that the legitimate studies show the higher the LDL in people over 60, the longer they will live because of the huge role that LDL plays in the immune system. Let me repeat that one more time. The higher the LDL in people over the age of 60, the longer they will live. That flies in the face of everything we've been told, and it's the polar opposite of what we are told. We are told that you want levels to be lower, yet the research shows the higher the LDL in people over the age of 60, the longer they will live. And again, that is because LDL plays a huge role in your immune system and protecting people against infections, even cancer for that matter, and also protective for the brain, and especially for this category that we're talking about today in this topic, it's protective for the lining of our arteries. So you're probably thinking, well, if all of this is true, then why in the world haven't they gotten rid of the cholesterol hypothesis? And I can give you one very important reason that is one of my favorite quotes that I have ever heard when watching a documentary, and that is this: just because something makes sense doesn't mean it makes dollars. The statin industry, as a reminder, is a $1 trillion industry that is built on that hypothesis. So I promise you, it's not going away anytime soon. And it's not going away because it makes a ton of money. So here's what we actually know about cholesterol. It is not the bad guy. It is not this scary thing that our body is producing for some reason to kill us. Like, why would that happen if you just step back and think about why would the body produce something that is harmful to us. What we know about cholesterol is it's a fat-like waxy substance. It's produced primarily in your liver. Now, we measure it in the blood, but we also know that even though we're measuring it in the blood, it's found in every single cell without exception in our entire body. And it's found in every single cell in our body without exception because it is needed to make cell membranes. It's needed to make key hormones like testosterone and estrogen, to make bile acids, which we talked a lot about a couple episodes ago in the gut health. Those bile acids, which also are produced in the liver and stored in the gallbladder, are needed to digest fats and to absorb fats properly so your body can use them. We also know that cholesterol helps produce vitamin D3, which of course is a critical part of the immune system. And then there's other factors as well that make cholesterol a critical player in our immune system function. And we know that cholesterol lowers inflammation when needed. And there are so many other roles because it affects and plays a role in every single bodily function that we have. So if high LDL doesn't cause heart disease, what does? Well, really, we just talked about it. If you go back to that fire analogy, we know that the damage in our arteries is from chronic inflammation. That chronic inflammation is where the true mechanism of cardiovascular disease happens. So the true mechanism of what happens is LDL, that supposedly bad cholesterol, shows up to protect our arteries that are damaged from chronic inflammation. Chronic inflammation is what causes heart disease, and the things that cause chronic inflammation, obviously very important to know: processed sugars, processed grains, processed bad dairy, food dyes, and other toxins that are just absolutely loaded into our ultra-processed food. And if you go back to some of the past podcasts, I talked about how the average child in America, 70% of their calories every single day comes from ultra-processed food. 60% of adult calories come from ultra-processed food. Those are the things that lead to chronic inflammation in our body. They lead to chronic inflammation in our arteries. And then LDL is produced in the time of need to help lower that inflammation in the arteries. So the chronic inflammation leads to scarring. That scarring in the arteries leads to clotting factors actually appearing. And that is why cholesterol goes there to help, to protect, to repair. So yes, cholesterol, LDL in particular, is found at the scene of the crime, but just because, again, it's found at the scene of the crime doesn't mean that it is the criminal. I promise you, LDL is not the criminal. It's not the arson. It is the policeman. It is the fireman. It's found at the scene of the crime. It is not the perpetrator of the crime. So the big question, how do we lower inflammation? Well, here's the great news. Because heart disease is a chronic inflammatory disease that happens gradually over time, over our lifestyle, or over our lifetime rather, with bad lifestyle habits, the good news, the great news, I think, is that by modifying your lifestyle, that means that it's reversible. So simple things. We're not going to go into detail today. If you want detail, go back to some past podcasts that I've had on all of these topics. Simple things that we know, like more exercise, more movement, gets the blood flowing, lowers inflammation levels. We know that the quality of water that you drink on a daily basis, meaning that it's filtered, it's gotten rid of the toxins, hugely important. And then also the quantity of the water that you're drinking every single day. Ideally, half of your body weight in ounces to flush toxins and inflammation out of your body every single day. We know that eating a well-rounded whole food diet free of, or at least limited amounts of ultra-processed and processed food will make a huge factor in lowering inflammation levels in your body. And then good quality supplements like the Foundational 4, a multivitamin, a probiotic, vitamin D3, and then specifically when we're talking about lower inflammation, omega-3 fish oil plays a huge role there. So those simple, and I mean simple, they don't have to be complicated, lifestyle changes will help to change the course that you might be on for setting yourself up for cardiovascular disease. Because the goal should always be to lower the risk factors for heart disease, right? Not to just artificially lower LDL for the sake of lowering LDL, and that is what statins do. They artificially lower LDL by shutting down the production of it in your liver. And there's no data to back that up. So it makes no sense to do that. If we're talking about artificially lowering it, well, what about diets and supplements? Because not everybody goes down that pharmaceutical path. A lot of people truly believe that they don't need that, so they look towards diet and supplements to lower the LDL, because we all are so ingrained in this cholesterol hypothesis that's 50 years old. So lowering LDL and total cholesterol through diet has also been shown in study after study after study to not be effective for reducing the risk of heart disease or death. But guess what? There's also a huge natural health industry of supplements and vegetarian and vegan diet recommendations that are just literally built around lowering your LDL cholesterol, lowering your total cholesterol, and they're all based on that outdated, not proven cholesterol hypothesis. And when you artificially lower LDL just for the sake of lowering it, which again is what statin drugs do, you're stopping the liver from producing LDL, as a reminder, and as a result of stopping that production, you interfere with all of the wonderful things that LDL is designed to do in our body that we just got done discussing. And if you stop the production of LDL and you stop LDL and the body's ability to do what it's supposed to do, which is to protect and to heal and to repair, guess what? There's going to be side effects. There's going to be consequences. And that really, when we're talking about side effects of something, especially with pharmaceutical drugs, that's what a side effect is. It is a consequence of interfering with a natural bodily process. Here's what we know about the common side effects of statins: belching, excessive gas, headaches, constipation, heartburn, indigestion, nausea, stomach discomfort, having a hoarse voice, having lower back pain, having side pain, muscle tenderness. Those are huge ones. Muscle weakness, pain or tenderness around the eyes and cheekbones, painful or difficult urination, stuffy nose, runny nose, excessive sweating, trouble sleeping. And that's just the common one. So I probably sounded like a TV commercial there, right? Pretty crazy, but that literally is just the common side effects. The list is literally endless, because if you are shutting down a normal, vitally important bodily process that is there to protect and heal, especially as we age, by the way, because we know that cholesterol levels go up in everyone naturally as they age, because we need more of it to protect our brains, protect our arteries as we age. We also know that the lower LDLs now are being linked to other things that are above and beyond what I just talked about in that side effect list. Early onset mental conditions like dementia and Alzheimer's. And again, if you understand this process, it shouldn't be so far-fetched. LDL is there to protect the brain. Well, if you remove the body's ability to protect it by shutting down the liver's production with a statin, you're going to have an increase in things like dementia and Alzheimer's. And that's what the new research is showing. Couldn't be much more important than this. Insulin resistance also plays a huge role. We know that when somebody is insulin resistant, what happens? Well, it's not a good thing, by the way. So you don't want to become insulin resistant, for those of you that don't know what it means, because if you become more insulin resistant, you increase your risk for diabetes. And we know that one of the side effects of being on a statin drug also is an increased risk of type 2 diabetes that comes directly from the drug. And then Alzheimer's now, many of you have probably heard it's being called type 3 diabetes. The reason it's being called type 3 diabetes is because of the role that insulin resistance plays for things like neurodegenerative brain diseases. But insulin resistance also plays a critical role in increasing heart disease and increasing cancer rates. So that's a lot of information, right? And I realize that all of this probably sounds pretty scary. I promise you, this is not me fear-mongering in any way. In fact, I look at it as the polar opposite. My goal here is hope-mongering, not fear-mongering. That's why I do this podcast. We're led to believe that our bodies are not self-healing, and we're led to believe we need a medication to be healthy, And that just couldn't be further from the truth. That is not how we're designed. And on a regular basis, in my office, I talk to people who are living an incredibly healthy lifestyle. They're exercising, they're eating a whole food diet. And then after all of this hard work, they take a look at their numbers with their MD and they say, hey, everything looks great except your LDL cholesterol levels are high. Your total cholesterol is high. This is a big concern. You probably have heart disease that runs in your family, so we're going to need to put you on a medication. I'm highly recommending that you go on a statin. I have these discussions with people all the time, and so there's a couple things that I tell them. So first of all, yes, those numbers probably do run in your family because guess what? They run in 100% of human beings' families. Cholesterol levels naturally raise as we age because we need more of it as we age to protect us. The other thing that I highly recommend to them and try to get across is really what today is all about and what I want your number one takeaway today to be. LDLs being raised by themselves, so LDLs raised alone, is not an independent risk factor for cardiovascular disease or death for that matter. So if you look at my levels personally, I get checked on a regular basis. Every 6 months, I have blood panels run to look at nutrient levels and to make sure I'm not missing things. And my latest LDL levels were at 173. So just a reminder for those of you that don't know numbers very well, should be less than 100 if we're looking at the medical data. So if I went into my MD, they would absolutely tell me that I need to be on a statin drug. Now, I'm not saying that you should just ignore these numbers because if you processed what you just learned today, this could be a concern. So the fact that my LDL levels are high absolutely could be a concern. So why would it be a concern potentially? It would be a concern if I also had high inflammatory markers. So if we go back to what LDL is for and how it's produced in the liver in the time of need to help the body heal and repair and to protect. And that happens during times of high inflammation. So if I had those high LDL numbers like I do of 173, and then also that was associated with or alongside of inflammatory markers, then absolutely I would be concerned. But I have those checked as well. So my triglycerides, so there's three things really that you should look for. These are the big factors when it comes to heart disease. You're looking at inflammatory markers. Triglycerides, absolutely. If those are raised, that's a big deal. And we know that triglycerides increase the more processed sugar that you eat. So if you want to lower your triglycerides, start cutting out sugar, and I promise you, you will see them go down. There's also something called apolipoprotein B, or ApoB as it's often referred. Also a big marker for inflammatory disease taking place in your body. And then there's something that a lot of people are very familiar with called C-reactive protein. It's also an inflammatory marker. So those are the big three. Look at triglycerides, look at apolipoprotein B, look at C-reactive protein. If those are raised and your total cholesterol and LDL is raised, absolutely a cause for concern. But LDL being raised alone, total cholesterol being raised alone, those are not a concern according to all of the legitimate studies that are done and not just the pharmaceutical data. So according to those studies that I talked about earlier, the more legitimate ones, if we look at the one where they looked at 12.8 million people, here's what that study said. So none of this is my opinion. The study said that you want total cholesterol levels to be between 220 and 240. You want HDL levels to be between 50 and 90, LDL levels to be greater than 120. And again, those numbers that I just stated should also be associated with all three of those inflammatory markers being in normal ranges. So if total cholesterol is crazy high and LDL is crazy high and you have inflammatory markers, absolutely something that you need to address. But then if you're going to address it, you have to ask yourself the question, am I going to artificially shut down the production of LDL in my liver with a drug or a supplement that artificially shuts it down? Or am I going to change my lifestyle habits so that my body can do literally what it was designed to do, to heal and protect. So I fully understand that this cholesterol hypothesis has been deeply ingrained in our thinking in our society, which is what makes this such a controversial topic. And when somebody challenges it, they're often laughed at. I have been many times in workshops that I've done, hands shoot up in the air. How can I make these statements? Or if you're a doctor like myself, you often get labeled as a quack, even though it's a hypothesis. We're not talking about science that this is based on. It's a hypothesis that is sitting around for 50 years, not based on science. So thankfully, it's not just people like me, not just crazy chiropractors that are talking about this. Over the last decade, more and more scientists, more and more doctors have been challenging this hypothesis. And for one very important reason that we've already talked about over and over today, there is no evidence to back the hypothesis up. So I'm not a cardiologist. I can't tell you to stop taking a drug, and that is certainly not what I'm doing. That is not the intention of this podcast in any way. The intention of this podcast is to educate you, to inspire you, to really educate you on the truth so that you can make the right decision for yourself. Because the right decision for me doesn't mean it's the right decision for you. You can make the right decision for yourself, because I believe that many people, and I believe the majority of people, would make a very different decision if they were told the real facts prior to deciding whether they should take a statin or not. So if your doctor said, hey, your levels are high, but here's what the inflammatory markers show, and really went into everything that we looked at today, talked about the side effects, talked about the truth, do you think as many people would say, yes, I want to be on that statin drug, as opposed to what happens, your levels are high, you need to go on a statin drug, or you're going to likely die from cardiovascular disease in the future. So the goal is to educate you, not to scare you in any way, shape, or form. If you want to dive into this topic further, there are 3 cardiologists out there. There's a lot of them actually, but there's 3 cardiologists that I love and respect that are speaking out against statins and a lot of other things, that standard of care that often isn't based on fact, that I highly recommend following. The first one is Dr. Asim Malhotra, and we'll have this in the show notes so you can see the actual names and the spelling. Next one is Dr. Jack Wolfson. He's one of my favorite. I've seen him speak a few times now. He's known as the natural health doctor online. And then Stephen Gundry is also, he's pretty famous at this point, and a lot of people know who he is. Those 3, all cardiologists, all cardiovascular surgeons, saw the truth, saw what was happening in their patients, and decided to leave mainstream and start speaking the truth so that the general public could make their own informed decision, which is exactly what this podcast is all about. The inspirational and educational takeaways for today. Number 1, as always, don't get overwhelmed. Don't get overwhelmed at all. Go back, listen to past podcasts, because success is simple habits performed daily over time. You don't have to incorporate everything at once. You don't have to revamp your diet overnight. You don't have to join a gym overnight. Simple habits daily over time. Don't look at like, what am I going to change? And it's going to have a dramatic change in my health in the next 6 months. Look at, what is my health going to look like in 5 years or 10 years if I make these simple changes and make them part of my simple daily routine. Number 2, there is no clinical correlation between lower LDL and a decrease in heart attacks, strokes, or death, and that applies to lowering it naturally or artificially with a statin drug. Not in my opinion, that is based on the literature. Number 3, listen to this podcast a second time, a third time, a fourth time. I often, when I find something that makes sense to me, but I don't fully grasp it, I will listen to it up to 7 times. That used to be my rule. I'm not saying you have to listen to this 7 times, but if you started to understand it and you're like, holy cow, there's more here that I need to understand and grasp, then listen to this podcast a second, a third time, whatever it takes. 4th, as always, you're a leader. Part of being a leader today, I'm asking you, share this podcast with everyone you know so they can also hear the truth. They can understand that our bodies are designed to heal, and they're able to make a decision for themselves what is the right move for their health and their future. Until next time, make health your hobby. Thank you for listening to the Foundational Health Podcast. As always, If you would like to learn more about making health your hobby, visit our website at foundationalhealth365.com and follow me on Facebook at Kevin Schultz DC Foundational Health.